Hi, I'm Emmanuel Kote. I'm here with
Nelson Anuba.
We are Team Nexus. We are excited to introduce to you our AI-powered assistive device, which is going to revolutionize how healthcare services are going to be delivered in both rural and Ghana. Many hospitals still rely on manual note-taking during consultation sessions. Due to this, it leads to incomplete documentation, poor tracking of patients' record, and also delay in diagnosis. Our Nexus device solves this by combining AI, cloud technologies, and IoT into one very intelligent device. So, unlike the normal hospital card we use, which has the patient's details on the card, with the Nexus device, we use the RFID card, which stores the patient's ID. So this is how the device is going to be used. Firstly, you turn it on with this power button. It has some sensors here. This checks your pulse and then the blood oxygen, and this is the temperature probe, which checks the temperature. So first turn it on. Yeah, so when it's on initially, this is the temperature of the room, 27.3 degrees Celsius. Yeah, and it's not reading any vital signs. So first you have to place your RFID card on the reader, the scanner, which is going to extract your patient's ID. Okay, I think it's done now. And when it's done, it's still not reading anything. So I'm going to read his vital signs with the device. So you can just place it here for some time while the temperature probe reads the values and okay. So here is the reading, the pulse. You can see the oximeter readings over here, the temperature and the blood oxygen. Yeah. So after the vital signs are being taken, the vital signs is going to be added to the documented consultation, the transcripts, and then the AI is going to generate a report based on the vital signs and then the conversation which was done during the consultation session, the transcripted form, and generate a detailed report which is going to be sent to the patients whose ID was extracted from this RFID card. So after you show the RFID card to the device, you can begin consultation by pressing this button. Good morning, I'm Dr. Philip. How are you doing?
I have been experiencing a headache for the past 3 days.
Okay, can you tell me more about your headache?
I feel it all over my head, and it gets worse whenever I look at a bright light source. So I have to go into a dark room to feel better.
Okay, does your family have any medical history of headaches or migraines?
Yes, my dad used to have migraines.
Okay, have you taken any medicine?
No, not yet.
Okay, let me review your kits. Then you press the button again to end the recording. So after the consultation, you can log into the dashboard. Then you go to responses. It's going to show you all the reports generated by the Nexus device. So I'm going to open this one right here. And over here, it shows the transcribed form of the consultation, which was transcribed earlier. So you can see what the doctor said and the patient's response and all that. And the consultation report gives you the time, doctor's name and all that. Then the summary of the complaints, it summarizes everything. Then after that, it gives you likely diagnosis based on the description of whatever the patients complained of. And it also gives you the differential diagnosis over here. Yeah. After the differential diagnosis, it also gives you some recommendations for lab tests and other imaging that can be done to confirm whether the diagnosis that has been diagnosed above is accurate or not. And it gives you the medical reasoning as to why it's suggesting such diagnosis. And it also suggests some safe medications and treatment plans. And it justifies why it gives all that too. So the justifications, you can see it over here. So that's all that's in the simple report. Okay, so if you don't have the Nexus device and still want to try out how it works, code for the desktop version has been provided in the GitHub repository. You can find a link to the repository in the description below. So after you set up your environment to run this code, you can use any of these IDs over here and insert them manually. Any of these 3 IDs, insert them manually over here, and then run the code. When you run the code, you can begin the consultation session, which will be transcribed, and the reports will be generated accordingly.
Welcome to Nexus Medic Hub. Let me move you through how the system works. So first, I'll just log in as a normal medical practitioner as a nurse. So I registered this person as a nurse. Alright, so once you log in, you get onto this dashboard which shows statistics of all the patients in the hospital. Here showing the total patients, the active cases, if there are any critical cases, any medical records, their age, statistics, patient data entry, and also recent patients that have been added into the system, their diagnosis, their admission dates and all that. But then you can access all patients from this page. So once you click here, you can just view the details of the patient to know much about the patient. Then at the same time too, you can also add a new patient as well, setting their blood group, their date of birth and all the necessary information. Then we have folders. Here you can access the folders of patients. So once a folder is created for a patient, you can view all their records and everything. So for instance, with this folder, I can see when the folder was created, who created the folder, the patient's information. I can click read more to read more about the patients here. Then you also have notes, you have tests. So if there have been any tests that was being done by the patient, you can view it here and even view the results as well. So normal, this was just a dummy data that we entered for testing sake. So we entered some data to test whether everything was working. So as you can see here, nose is try again. Then attachments, you can see attachments. If let's say there happens to be a test of which they have documents on a test, that one too can be uploaded here. Then diagnosis, if the person was being diagnosed of any disease, that one too will be shown at this particular site, and if there is any treatment plans to be shown here or in the folder, and it keeps all statistical data, all history about the patient at the hospital. Then you also have the responses and diagnosis. This is the particular part that links with the robot. So once the robot has an interaction, before a user can have an interaction with the robot, they have to insert their hospital ID or their ID card. Then the robot is able to extract the ID, and once the robot is done extracting the ID and taking all the vitals, then the robot can now proceed with communicating with the user. So after communicating with the user, the robot now gets a summary of the communication and sends the communication to the backend. That's the report side, where a doctor or any medical practitioner can view the report and diagnose the user. So for instance, this is a report that was generated from the robot. Once I click view report here, I'll be able to see the conversation that the robot had with the user, the time and everything. And me being a doctor or me being the medical practitioner, I will then read through all the conversation, know the sentence and everything. And once I'm done with that, I can now diagnose the patient by clicking the show form here. Then I'll enter the diagnosis name, the diagnosis code. Based on the conversation, I'll be able to know whether the condition is very severe or not, and also type description, whether they have to be given certain medication and all that. click on the active or resolve or pending, and after that click on create diagnosis to create the diagnosis or to diagnose the patient. This part is access denied, so for this one no one can access it, and we've made it in such a way that for stuff like testing or for user test, when maybe a patient run a test, for that one we've made it in such a way that only users who are actually the medical laboratory technicians are able to access that site. So they are the only people that are allowed to send test data or upload test of patients. And also the admin can also do the same, because admin has all the privileges. So for instance, when I log in as the admin here, you could see that the manage tab is now open, and for the admin I'll be able to add new staff, as in adding new people to the system, whether the person is going to be a lab technician or going to be a nurse or any other thing. I can add it here. Then last of it all, the manual control. This is yet to be implemented. So from here, a doctor or any medical practitioner will be able to control the robot remotely. So a doctor can be anywhere around the world and can control the robot in the hospital. Yeah, this is a feature that is yet to be implemented.